In Vienna's General Hospital in 1847, 1 in 10 women who gave birth died of a mysterious fever. One doctor figured out the cause and the cure. The medical establishment responded by ruining his career, committing him to an asylum, and ignoring his discovery for another 20 years. The death toll: hundreds of thousands of preventable lives. Vienna in 1847 was a center of European culture and science. At its heart stood the Vienna General Hospital, renowned for medical training. Within its walls, a quiet and persistent horror was unfolding. It was a place of new life, shadowed by frequent and unexplained death. The affliction was called puerperal, or childbed fever. The onset was swift: high fever, severe abdominal pain, a rapid decline into weakness. For many, death followed within days, leaving grieving families and orphaned newborns. The hospital housed 2 maternity clinics operating side by side. The first clinic trained physicians and medical students. The second trained midwives. In the first clinic, about 1 in every 10 mothers died. In the second clinic, fewer than 1 in 50. In a typical year, over 450 deaths in the first clinic, under 100 in the second. Same building, same air, same water, same conditions, same patients. Administration tried ventilation changes, altered rites, even new birthing positions. Nothing worked. The mystery was vast and the toll intolerable. Into this confusion came a young Hungarian doctor, Ignaz Semmelweis, appointed assistant in the first clinic in 1846. He oversaw the ward, taught students, and performed autopsies, meeting the fever's reality daily. He watched, counted, documented. The data confirmed a brutal disparity. Doctors began in the autopsy room, then examined living patients. Hands were cursorily wiped, then moved from the dead to the living. Midwives did not touch corpses. Their work stayed strictly within the ward. In early 1847, Semmelweis's colleague Jakub Kolečka suffered a minor scalpel prick during an autopsy. The wound was trivial. Days later, he developed fever, chills, widespread inflammation, and died. Semmelweis studied the autopsy report. The pathology matched what he had seen in mothers who died of childbed fever. It was the same disease process. For Kolečka, the source was known: a scalpel contaminated by a corpse-introduced material into his blood. Semmelweis reasoned, if cadaveric material could kill a colleague, doctors' hands could carry the same to mothers. He proposed cadaveric particles, tiny, unseen matter from the dead, were being transmitted by touch. During examinations, particles entered via the small wounds of childbirth, triggering systemic infection. Simple washing was not enough. The odor lingered. He adopted chlorinated lime, calcium hypochlorite, to chemically destroy the particles. In May 1847, he made hand washing mandatory for all who entered from the autopsy room. Not a rinse, but scrubbing until the cadaveric smell was entirely gone. There was skepticism and reluctance. The solution was uncomfortable and implicitly accusatory. Semmelweis enforced it anyway. The stage was set for a decisive test. April 1847, 18.3% mortality. After hand washing, it fell immediately. May, 2.2%, and in subsequent months, at times to 0. Despite overwhelming numbers, Semmelweis met skepticism, ridicule, and hostility, beginning with his superior, Professor Johann Klein. His conclusion contradicted established doctrines, especially the miasma theory. Worse, it implied that doctors' hands had been killing patients. Status in 19th century Vienna rested on reputation, tradition, and gentlemanly bearing. Critics attacked his statistics, calling the drop coincidence or attributing it to other changes that had not occurred. Without germ theory, cadaveric particles seemed fanciful, invisible, and unproven. Rudolf Virchow dismissed the evidence as insufficient and limited to one hospital. Brilliant but not political, Semmelweis grew frustrated. He delayed formal publication, sending exhortations instead. His tone hardened, calling colleagues irresponsible, accessories to homicide, rhetoric that alienated allies and hardened opposition. He was painted as a radical eccentric, attacking the profession's honor. But this was not merely a dispute about one clinic. It revealed the structure of scientific resistance itself. Thomas Kuhn would later give it a name: paradigm. Thomas Kuhn argued that science proceeds within paradigms. Normal science, anomaly, crisis, new paradigm. A paradigm comprises accepted theories, methods, and implicit assumptions. For Semmelweis's contemporaries, miasmas, humors, atmospheric conditions frame disease. Anomalies first meet reinterpretation under the old rules. Data questioned, methods attacked, the researcher dismissed. Resistance is rational for people whose identity and status are built on the challenged model. Defending the paradigm is defending their world. Alfred Wegener's continental drift was mocked for decades, absent a mechanism. H. pylori and ulcers were dismissed in favor of stress and lifestyle, until the evidence forced a shift. Acceptance often follows the slow retirement of an old guard. Institutions preserve and transmit knowledge. They are not designed to embrace revolution, especially from outsiders. But when anomalies accumulate and a clear alternative appears, the paradigm must change, or the cost becomes unbearable. After Vienna severed ties in 1849, Semmelweis returned to Hungary, enforced hand-washing again, and mortality collapsed. He published in 1861 a dense, furious book that mixed data with polemic. By 1865, his behavior had become erratic. The causes remained debated: neurologic, infectious, or the weight of despair. He was lured to a Viennese asylum. When he resisted, guards beat him and confined him. A wound on his hand became infected. He developed gangrene and sepsis. 14 days after admission, Ignaz Semmelweis died at 47, the very infection he fought claiming him. Across 2 decades of rejection, the preventable toll mounted into the hundreds of thousands. Within 2 decades, Pasteur and Koch established germ theory. Semmelweis's cadaveric particles were recognized as bacteria. Joseph Lister built antiseptic surgery. Hand-washing became foundational. But recognition came too late for the countless women who died needlessly. We honor him now, and we must honor the lesson. Professional pride, dogma, fear of error, and dismissal of inconvenient data still slow progress in science, medicine, and policy. Semmelweis's legacy is a call to humility. Listen to data even when unwelcome. Reward truth over status. What simple, life-saving truths are we ignoring today? And what is the price of our ignorance?